I'm joined now by Dr. Charles Howell talking about AASLD's very important session on ethnic and racial disparities in liver disease. Can you talk to me about some of the really critical problems?
So first of all, the importance of racial disparities and ethnic disparities is the fact that the U.S. population is undergoing significant changes in terms of demography. So it's estimated that between now and say 2050, that the population will change, that the non-white population will actually become the majority. And with the largest growth in Hispanics, who would then be approximately 20 to 30% of the population, and then African Americans about 15%. So it's been well established that there are significant differences in the incidence, prevalence, and outcomes of disorders based on race and ethnicity. And there are many factors contributing to these differences. However, in order to try to eradicate them and to improve the health status of racial and ethnic minorities, it's important that providers be aware and to understand some of the underlying causes that are known at this point.
Well, the awareness and identifying those causes is going to help people bridge the gap. So what are the biggest contributors to this at this point?
Well, we know that certain disorders are more common in certain segments of the population. For instance, hepatitis B, we know it's first of all, it's much more common in the Asian population than in, say, native-born U.S. populations. And so many of the persons, most of the people with hepatitis B in the U.S. are immigrants from countries where hepatitis B is more prevalent with, say, for instance, Asia, the continent of Africa, India, etc., in some parts of South America. So, and in those populations, hepatitis B is a major cause of liver cancer. And so what we see is as people immigrate to the U.S., they bring those diseases and those predispositions with them. And so we began to see expression and manifestation of those diseases here in the U.S. population.
But in their home country, the doctors may know to look for it, and we need to educate the doctors to see that here.
That's right. And in hepatitis B, for instance, for hepatitis C, the prevalence is much higher in African Americans, for instance, than whites, about twice as high. And the outcomes in terms of liver cancer and deaths and mortality related to liver disease are also higher in the population in African Americans.
In this session, will you outline specific strategies to try to really identify and fix the problem?
Yes, in a general sense. Basically, this session is going to focus on three disorders: primary liver cancer, or hepatocellular carcinoma, non-alcoholic fatty liver disease, as well as liver transplantation as a therapy. And so it's going to focus on what we know about racial disparities in these particular areas.
And it's such an important topic. Knowledge is definitely power. Thank you so much, Dr. Howell.
Thank you.